want to pay for other people's health care, my brother in Christ. That's what insurance is. That's what it is. You pay money for other people's health care. That's how insurance works. Oh my God.
My medication, it runs $20,000 a month without insurance. I make $800 a month. Oh, that will kill me. That would kill my friends.
This is quite literally what you voted for. Why are you so confused? You voted for the man that wanted to take away Medicaid. He took away the Medicaid, and you're shocked? You can't afford your medicine? Oh, don't worry. I'm sure that Doge check's still on the way. I do not care. I legit do not care about any of these people. They voted against their own interests. They voted against themselves. Why should I give a fuck that he can't afford his medicine? He should have thought about that before voting for the candidate that wanted to make it so he couldn't get it. Call me selfish, call me heartless. I really don't care. These people fucked around and now they're finding out. I don't care. And the thing is, they don't regret voting for Trump because Trump is a bad guy and he's hurting people. They regret voting for Trump because now they are being affected. When Trump was only affecting the brown people, they were like, yeah, fuck yeah, Trump, woo! But now that it's starting to affect them, now it's like, oh, wait a minute. I didn't vote for this. Yes, you did. You sure did. So I don't know what you expect people to do. Maybe call your president. Maybe your president could call his little billionaire friends and they can help you out. Because unfortunately for you, all I have to give are concepts of thoughts and prayers.
Never forget that elections have consequences. For one city in Nebraska, they're learning that shit the hard way. Curtis, Nebraska has a population of 806. Just the kind of place with a single traffic light, one health clinic, and a fuck ton of American flags. And in 2024, over 85% of them voted for Donald Trump. Now, their only medical clinic is shutting down by September 30th of this year. It's the kind of place people went for everything. For checkups, blood work, urgent care, you name it, that's where they went. And once it's gone, they'll be looking at a 40-mile round trip just to see a doctor. So who have they decided to blame? Not Trump, not the Republican Party. They're blaming the hospital executives. Like this is some sort of isolated business failure and not the direct result of the GOP's big, beautiful bill that gutted Medicaid and rural healthcare funding. That bill slashed nearly $1 trillion from Medicaid. Small-town hospitals like Curtis's, they were the first ones thrown under the bus, and the GOP knew it was coming. And now look where these people are. Sick, stranded, and still making excuses for the guy who signed their death warrant. But this is the cost of voting for the con man, guys. Your taxes don't get you care. Your vote doesn't get you help. It just buys you a slower, more painful collapse. So when you say you support law and order and protecting life, but watch your hospital close down under a president you put back in power, you're not just a voter. You're the getaway driver.
You didn't get a wall. You didn't drain the swamp. You didn't get affordable health care. You didn't eliminate the national debt. You didn't get new infrastructure. You didn't get Hillary Clinton locked up. You didn't get Epstein accountability. You didn't get a $5,000 Doge check. You didn't get a $2,000 stimulus check. You didn't get lower grocery prices. You didn't get help buying a home. You didn't get America first. You didn't even get peace. You lost family, friends, and credibility. So what did you gain?
Imagine voting for a political movement because you believe it was going to make your life better. You believed prices will come down. You believed government will finally start working for ordinary Americans. You believed your family will be protected. But then the consequences of political decisions begin showing up in the most personal place possible, the healthcare. And suddenly, the politics that seemed like a distant Washington debate become painfully real. In the doctor's office, in the pharmacy, the insurance bill, the hospital, the family budgets, and now some Americans who once celebrated political promises are asking a completely different question. Did we vote for something that is making our lives harder? But before we go any further, let's be clear. Not every MAGA voter regrets their vote, and healthcare policy is complicated. The point of this conversation is about Americans who are experiencing or fearing higher costs, reduced coverage, or changes to programs they depend on. And for those people, the political awakening can be brutal.
Like the hope some New Yorkers must have felt with all the false promises Republicans made to them, and then they did the opposite. I just saw an interview of a MAGA Republican being asked what they'd like to say to Trump right now, and he was so sad and deflated and just said, "Don't forget about us." Man, they didn't forget about you because they were never thinking about you at all. Everything is more expensive, and they're still lying to your face saying the economy is the best it's ever been.
I lost my health insurance coverage back in September when my subsidies went from $25 a month to $516 a month. And this was not like premium top grade insurance, right? And so I have been without. And I was hanging out with some older friends of mine last night, and they were telling me that, you really need to be on health insurance. If you get hurt, if you get sick, you will be financially ruined. And I was telling them that I had been on health insurance for the last few years. And the last several times I went to the doctors, they did not help me. I had to pay hundreds of dollars out of pocket for doctors to look me in my face and say things like, use your hands less. That was the actual medical diagnosis. When I went in, I thought I had rheumatoid arthritis in my hands at age 35. And my doctor's advice was use your hands less. I paid money for her to tell me that. And then last year, I had a stomach issue. I tried to go to the clinic and they're like, well, because it's your stomach, you have to go to the ER in case you're pregnant. I'm like, I'm definitely not pregnant. It is a 0% chance that I am pregnant. Let me just assure you, okay, the life I live, I'm not pregnant. And they're like, sorry, I literally could not go to a clinic, which only would have cost me $120 out the door for everything that I needed. They had to refund me and make me go to the ER. So then I'm at the ER for 5.5 hours. I have to get a CT scan, which charged my insurance $15,000. I end up paying over $600 out of pocket for, at the end of this visit, for the doctor to look me in the eyeballs and shrug and say, maybe try over-the-counter antacids.
Whenever the government cuts Medicare or Medicaid, disabled people get kicked off the programs that keep them alive. Because we are the waste that they are talking about. Our continued survival is something they consider fraud. Even though the federal government says that most overpayments are a result of administrative error or incorrect documentation rather than intentional fraud, sure, maybe there are some people out there that are committing fraud. But if you are so committed to crackdown that you're okay with disabled people being your collateral damage, that's just eugenics.
So, I always promised to be, raw and open with you guys. I'm having one of the worst fucking days of my life today. Probably one of the worst days in a very long time. But, I got a letter in the mail today saying that they're canceling my health insurance. I'm not gonna have health insurance on Thursday of this week. The Commonwealth of Massachusetts didn't even give me a reason, really. The reason I got was Mass Health got information from available state or federal data sources that affect the eligibility of this person. Nothing has changed. And I just got this in the mail. And it says it cancels on the 6th. I have 4 days to fight this because I can't do it tomorrow. Tomorrow's Sunday. I have to do it Monday, Tuesday, Wednesday. And I don't know what to do. And I'm on Medicaid, so it's Mass Health. I'm freaking out. How can they do this to someone?
Okay, the American healthcare system is fucked up. And I don't know what to do about this. And I need you guys to help me make this make sense because this does not make any sense in my brain space. And I'm gonna tell you about it, okay? Okay. So at the beginning of this year, I, along with millions of other Americans, lost my Medicaid, which is really extremely shitty, but it happens. and I've been trying to figure out what I'm going to do from. So in order for me to have a private insurance for myself, it is $767 a month because I have multiple pre-existing conditions, including high blood pressure, asthma, and ADHD. My medicines are not cheap. I have to go to the doctor often, and I have several specialists that I go to see. So that brings my price up quite a bit more than what, your average, normally healthy person would. So for this entire year, I have not had health insurance, which has been terrible. And some of my medicines are affordable, like my antidepressants, which are like $60 for a 3-month supply, along with my high blood pressure medicine, which is like $100 for a 3-month supply. Those are not terrible. Those are affordable. And that's fine. Now, my issue that I'm running into is where first my ADHD medicine and second my inhaler. Now, my ADHD medicine's like $400 a month. So I just have not been taking that, which it sucks, but it's survivable without, being on pills. I don't need to worry about that. However, my inhaler by itself is almost $300 a month. That's $287 a month. Now, GoodRx has coupons for it, which brings it down to $221 a month. That's not great, but it's a little bit cheaper. So in one of my videos, I was talking about this because I make cleaning videos. So I was talking about my inhaler and the things going on with it. And everybody was suggesting to me to go online and get the manufacturer's coupons. I'm like, that's great. I can go online and look for manufacturer's coupons. So my inhaler is a Symbicort inhaler. Now, generally I get the Brena because the Brena is the off-brand of Symbicort and it is generally cheaper than the Symbicort. And so my first thing was I went on to Brena's website to look for a manufacturer's coupon. Brena will not allow you to use a manufacturer's coupon unless you already have insurance. So I go to Symbicort's website. It directs me to AstraZeneca, which shows I put in all of my information and everything. I plug it in, whatever. And
The US healthcare system is insane. I just want to start this off by saying that I have really good insurance under my parents' names. And I had to go to the ER in November for a cluster headache that was on day 2 that would not cease after migraine medication, everything that I could take and think of. So I had to go to the ER to make the pain stop because I literally couldn't do anything without shooting pain. Anyways, for the one visit, $34,000. $28,000 is not covered. My mom goes, well, when you go to the ER, did you check that they were in network? And I said, it's the same building where I go to my other doctors. I figured it would be in network. She goes, no, Lindsay, sometimes if the ER doctors are not in network, you have to check for the individual doctors. I'm like, Mom, it's the ER. You think I don't check? I don't check that before I go. I just...
Well, y'all, another hospital is closing down their labor and delivery unit. Makes a third this year. Yeah. And that brings Arkansas up to 51 counties in the state without a local hospital where a baby can be delivered. We only have 75 counties, y'all, and 51 of them don't have a labor and delivery unit. So this seems like a timely reminder that while Sarah Huckabee Sanders is on her annual European trade mission, living it up on the taxpayer dime, Arkansas still remains the most unsafe place in America to be pregnant, to have a baby. That's right. Yes, Arkansas has the highest rate of maternal mortality in the entire country, and it is also the only state that has not extended postpartum Medicaid coverage to 12 months. Even after a young woman walked into the Arkansas River with her baby, Sarah is still single-handedly stopping Medicaid expansion for postpartum mothers here in Arkansas. I mean, even Republican state legislators have pushed for this, y'all. It's honestly, everybody wants this. It's bipartisan, and a legislative push isn't even really necessary right now, okay? They don't have to wait until the next legislative session in 2027. The Department of Health could expand pregnancy Medicaid right now through an administrative waiver, but Her Majesty the Governor has to sign off on it, and she absolutely refuses. So I want you to remember that in the most pro-life state in America, women will die from preventable medical complications, while Sarah is out here bragging about her really important accomplishments, like protecting youth sports from literally 0 transgender athletes.
That's why Arkansas got men out of women's sports.
Have the day you voted for.
In case anyone is curious at how fucked up the United States medical system is, I just got an estimate for my 9-year-old's tonsil and adenoid surgery in July. Tell me why. Tell me why a 20-minute surgery, that's how long they said it would take, 20-minute surgery, to remove my 9-year-old's tonsils and adenoids is estimated to cost $108,447.46.
If you ask people what their biggest worries are right now, many of them would say the high cost of living. Affordability is one of the top issues concerning working individuals and families. And those high costs didn't just come about arbitrarily or from normal inflation. They're a clear result of the Republican tax law passed last summer. The one Derek Van Orden, Glenn Grothman, and their Republican colleagues in Congress celebrated passing. Now, 1 year later, we're seeing the direct impact of their votes. The GOP tax law includes $1 trillion in cuts to Medicaid over the next 10 years, as well as the expiration of enhanced ACA tax subsidies, which led to huge insurance premium increases many individuals simply couldn't afford. The funding for SNAP, our nutrition assistance program, was also cut by $187 billion. This has led to significant decrease in the number of Wisconsinites who are already struggling to afford grocery bills and school lunches. Over 14,000 Wisconsinites have already lost Medicaid coverage since last June, and over 22,000 fewer people have enrolled via ACA Marketplace, and it's only going to continue. Those cuts to Medicaid and SNAP didn't benefit us in other ways, like reducing debt or lowering taxes. Those trillions of dollars just provided tax cuts to billionaires and big corporations. Meanwhile, it's harder than ever for the people of Wisconsin to pay their bills and buy groceries. Many families are one big health event, one accident or illness away from significant financial hardship because of the cost of healthcare, even if they have health insurance.
So it was reported today that Vivek Ramaswamy is talking about cutting unauthorized spending. Unauthorized spending is spending that the government does, but has not authorized it, or their authorization has ran out. One of those things was a bill that authorized spending back in 1996, I believe, for veterans' health care. $120 billion is going towards veterans' health care. Another one of those things is the Head Start program for people with lower income that can have their kids in preschool or after-school care that's provided by the government. Money that's provided by the government runs this whole program. So my question is, you have kids, you're low income. You voted against your kids being able to have education. I mean, you already know they want to blow up the whole Department of Education. You're a veteran. You voted for Trump. That I'll never understand, because he's never been on the side of our military. If anything, he's been against them. So if you voted MAGA, because it's MAGA, you're going to lose both of those things, and you deserve it. If you didn't, I'm so sorry that these people brought you down with them.
I have a new bingo card item. I think that when people figure out that their health insurance is gone and we watch these jobs plummet, because remember, right now we're at the very start of it. This was the warm up. When it sets in truly and people lose their health care, I think the backlash is going to be so astronomical. I think it's going to be our shot at universal health care. Everyone talks about the pendulum swinging back, and that is a thing. Think about it. Think about all the people that are about to lose their health care. Think about all the people who are about to realize how tied in to the job that their health care is. And especially with us discovering where our taxes are going and whose health care we've been paying for universal, a lot of Americans that before have always been against it are now asking, well, why can't I have universal health care? So yeah, my new bingo card item before 2023 even, I think we're going to see a true universal health care plan hit Congress floor. It may not be voted approved. It may take a while, because they just be fighting over bullshit. I think the backlash could be so swift though, because it's not gonna be nice swiftness. It's not gonna be peaceful.
We say what you want. Like, they're the ones promoting it. I'm saying stay peaceful. But.
Hey there. I'm here for my insulin refill.
Sure thing. That'll be $1,278.
You're joking, right?
Nope. Medicare no longer covers this under the new privatized voucher plan. You voted red, right?
Well, yeah, but I didn't think they'd come for me. I thought we were saving money.
You did, by transferring your healthcare costs directly to you.
But I need this. I've been a diabetic for 25 years.
And the free market thanks you for your loyalty. Would you like to open up a payment plan for 17.9% APR?
That's insane.
Well, you better start rationing. It's what your politician said builds character.
That was what I had to do, go to the emergency room and pay the bill somehow, some way.
Wait, how do you have health insurance?
How do I have health insurance?
Yeah.
I pay for it.
So is it through your employer?
Through the state. I'm also on Medicare.
The Trump administration wants to defund it. Yes.
Right. I don't believe it. There's no evidence of that.
Well, he did it already. The big beautiful bill defunds Medicare.
Oh, really? That's why I'm still on Medicare.
Yeah, it's gonna defund it after the midterms.
Really?
Yeah.
Okay, we'll see when that happens. Because I'm still paying for the service. It's not free.
I'm aware. I mean, but
they take it out of your Social Security check.
I want you to get Medicare. I want people to get Medicaid. I want you to be able to live in dignity for the rest of your life. And the Trump administration is actively trying to defund the things that you need to live.
I don't believe that.
And it's going to kick in after the midterms.
I don't buy that, and we'll see what happens. You're looking into the crystal ball.
I'm going to put like a little blurb right here showing what the big beautiful bill defunds. Basically, it's going to go right here.
Right.
So
you can prove that I'm ignorant, but that's okay.
Go right there.
I don't believe you. I don't buy it. I know you're a left-wing liberal, and a lot of things you say are kind of like slanted.
How about this? We see each other at MAGA events repeatedly. Right. Can you make a commitment that you're going to look that up?
I certainly will.
Once you've looked that up, you can come back to me the next time you see me.
Yes.
And you can say, hey, I looked it up. Let's go over the nuances of that, right? And then we can have a proper discussion on that.
All right.
Thank you.
Walter, it's been a pleasure.
Thank you so much.
So I'm finding out that Trump supporters are upset because they're about to lose their health care and their insurance, and their children that are under the age of 26 are about to be kicked off because they voted to repeal the Affordable Health Care Act. And they didn't even realize that they were doing this. And I'm going to pretend that they're not racist. And
millions of seniors are about to see healthcare prices soar across America as the Trump administration overnight announced that it is ending what is called Medicare Part D subsidies. These subsidies will officially expire at the end of 2026 and will not be available to the millions of seniors who rely on the subsidies to keep prescription costs lower heading into 2027.
Right? People are going to think I'm fear-mongering, but this is all a money grab and cruelty to be cruel. Okay, hear me out. There are two things that people aren't talking about when they're talking about the subsidies ending that they should be. One is the tariffs that start the year after the subsidies end, right? 200% tariff on generics. Medicare Part D forces you to have generics. Unless you go through absolute hell to get a brand name. Okay? So all the pharmaceutical companies are going to make a fortune. And you say, well, they don't get the tariffs. They will get the tariffs back from us, the taxpayers, again, when the Supreme Court orders the government to pay it back again. We pay it, then they have to pay it back again, right? Number two will be non-compliance, because when these elderly cannot afford the tariffs and can't afford all the jacked up prices, right? They're going to go non-compliant. And I don't know if people realize this, that most health insurance has non-compliance clauses in their policies. If you do not pick up your prescriptions, they know. And they have ticked a box that will automatically jack up your premiums the next year. Plus, they'll also kick in AI to start denying healthcare visits, all kinds of healthcare, because you are non-compliant. You didn't pick up your prescription. You are making your health worse. It's all a con, and it's all about cruelty is the point, because if they can get some elderly off of Medicare, it's all the point.
Iowa is heading toward a healthcare crisis, and our Republican elected leaders in Washington are helping to accelerate it. Republican proposals moving through Congress would cut nearly $1 trillion from Medicaid and hundreds of billion dollars more from SNAP, the food assistance program that thousands of Iowa families rely on every single month. These cuts are being framed as budget savings, but here in Iowa, the consequences would be devastating. When Medicaid gets cut, rural hospitals close. We already know what happens next. Longer drives for emergency care, overcrowded ERs, nursing homes getting shut down, and families forced to choose between groceries, prescriptions, and rent. More than 700,000 Iowans rely on Medicaid, including children, seniors, people with disabilities, and working families. Rural hospitals across Iowa already operate on razor-thin margins. Major Medicaid cuts could push many past the breaking point. Yet, Iowa's Republican delegation, including Ashley Hinson, Randy Feenstra, Marionette Miller-Meeks, Zach Nunn, Joni Ernst, and Chuck Grassley, continue supporting the broader budget framework behind these cuts. Healthcare access is already shrinking. Labor and delivery units are disappearing. Mental health care is limited. Many communities are struggling just to keep providers and hospitals open. Medicaid is not just a government program in Iowa, it's healthcare infrastructure. It keeps hospitals open. It funds nursing homes. It helps children get care and seniors stay alive. And SNAP matters too. Food costs are still high. Families are stretched thin. Cutting food assistance while slashing healthcare support will hit rural and working class communities the hardest. Listen, Iowa cannot continue down this path because once a rural hospital closes, once a nursing home disappears, once families leave because care is no longer accessible, those communities rarely recover.
Hatred and bigotry is about to cost red states and red voters their hospitals and healthcare, and they have no understanding that that's what's going to happen and that the Democrats are actually trying to fight for them. See, Trump's big, beautiful bill cuts Medicaid, and here's the truth. MAGA has no understanding of how Medicaid works. See, Medicaid isn't just some line item. It's a federal and state partnership. The federal government pays a percentage of each state's Medicaid costs through something called FMAP, the Federal Medical Assistance Percentage. And here's the thing. Red states get the highest FMAP. The poorer the state, the bigger the federal share. For example, Mississippi gets 77% of their Medicaid paid by the federal government. West Virginia, 75%. Kentucky, Arkansas, Louisiana, 70% and more. Meanwhile, wealthier states like California only get 50% of the Medicaid bill federally funded. New York, just 55%. So when Donald Trump and Republicans slash Medicaid, it's not blue states that collapse. California and New York already fund nearly half of their own programs. They'll manage. It's red states that get destroyed. They depend on the federal government's dollars. They depend on the very federal funds that MAGA is now cutting off. So what happens when that money disappears? States are going to kick people off Medicaid who currently qualify. Rural hospitals, which are already barely hanging on, are going to shut down. Seniors, kids, pregnant women, and people with disabilities are going to lose care. And here's the ironic part about it. Most Medicaid recipients live in red states. Blue states will be fine. Red states will lose their safety net. And meanwhile, the Democrats are the ones fighting to protect those very programs in the budget negotiations happening right now. Democrats are trying to keep Medicaid so that the rural hospitals don't close, so that families in Mississippi, West Virginia, and Kentucky don't get abandoned. So let's call this what it is. Trump and MAGA are cheering for cuts that will devastate their own voters. Democrats are trying to say...
Check this out.
We've got to support Trump or civilization will collapse. Those are quotes. And it's true. I'm calling for it right now. 25th Amendment, impeachment, whatever needs to happen to get this front and center, to get control of our country.
I've been very open with the fact that I will be supporting Trump. I'm completely embarrassed that I supported Trump in the past because of, the fact that he completely flipped on his entire base.
I wish you the best of luck.
Thank you very much. It's
I'm
a great
behind
honor.
you. I never even wanted Trump to win until he was the only guy to vote for.
Dude, Trump is the man. You guys ever meet Trump? You talk to him? No, you meet him and he's actually a solid guy.
When you're at a Trump rally, you're like, oh, I could definitely see how Hitler happened. Like, I'm not joking to you, dude. When you go to a Trump rally, it makes you question the sanity of everybody. If Trump said, go grab a gun and go do anything, they would do it. They would do it.
I know, it's a cult.
I became an active Trump supporter when they raided Mar-a-Lago.
You and I and everyone else who supported him, you wrote speeches for him, I campaigned for him. I mean, we're implicated in this for sure. I want to say I'm sorry for misleading people and it was not intentional.
Look at all these Republican influencers turning on him. Is it because he didn't keep his promises? Is it because they know he's implicated in those files? Or maybe they just didn't get paid for promoting him, like so many other contractors he's worked with before. Either way, it's a sign of the times. His own base is getting sick and tired of his bullshit. It's about fucking time.
Irma isn't the only one in District 22 who feels betrayed by the administration's plan to gut Medicaid.
And Musk doesn't need it. Billionaires don't need it.
They're making out big time with this, but they're hurting people in the process.
If we could go back to November, who would you vote for now, seeing what you see?
Yeah, instead of realizing what's happening to her family, her community, she still says she wouldn't have voted. I understand that we need folks like this to understand what they did was not going to benefit them. But I also feel like we have to be accepting and we have to welcome people and bring them into the tent wherever they are in their process of understanding that they got screwed over.
For years, healthcare has been one of America's biggest political battlegrounds. Politicians talk about government spending. They talk about Medicaid. They talk about Medicare. They talk about insurance premiums. They talk about cutting waste. They talk about reducing government. But ordinary Americans don't experience healthcare as an abstract budget line. They experience it when their children get sick. They experience it when they need medication. They experience it when they receive an unexpected medical bill. They experience it when they discover that the insurance plan they depended on has changed. That's when political slogans disappear. Because illness does not care whether you voted Republican or Democrat. Cancer does not ask whether you support MAGA. Diabetes does not care about your political affiliation. And hospital bill does not check your voter registration before arriving. Now imagine someone who spent years saying, government needs to get out of our lives. Maybe they believed cutting government spending was necessary. Maybe they believed government programs were wasteful. Maybe they believed other people were receiving benefits they didn't deserve. But then something happens. They lose their jobs, their insurance changes, their prescriptions become unaffordable, a family member needs long-term care, or they discover that a program they thought only helped other people was actually helping people in their own community too. Suddenly, the political conversation becomes personal. And that's when some people begin asking, what exactly is being cut? This may be one of the biggest lessons in the entire debate. People often imagine government assistance as something that happens to someone else until it happens to them. You may be healthy today, you may have a good job today, you may have excellent insurance today, but life can change. A company can downsize, a recession can arrive, a serious accident can happen, a spouse can become sick, a parent can age, and suddenly the programs you once dismissed become extremely important. And that's why social safety nets exist. Not because every person receiving assistance is lazy, not because every program is perfect, but because life is unpredictable. For Black Americans, these conversations also carry historical weight. Black communities have experienced generations of unequal access to healthcare, wealth, employment, and other resources. That history matters when discussing today's economic and healthcare inequalities. But this should not become another reason for Americans to fight each other. Instead, it should remind us that healthcare insecurity has affected different communities in different ways. And today, millions of Americans across racial and political lines can find themselves facing similar fears. Black, white, Latino, urban, working class, middle class, Republican, Democrat, and independent. Healthcare can become a crisis for anyone. Political campaigns are built around promises that things will get better, your family will save money, we will fix healthcare, we will protect working Americans. But governing is different from campaigning. Once politicians are actually making policy decisions, there are trade-offs. Someone benefits, someone pays. One program expands while another may shrink. One group receives protection while another may face new costs. And voters eventually get to see the consequences. And that's why citizens should simply ask which politician sounds better. They should ask, what exactly is this policy going to do to my family? Maybe the most important lesson is not about MAGA. Maybe it is about every voter. Don't vote purely because someone tells you another group is the problem. Don't vote because a politician gives you a simple answers to a complicated problem. Ask questions, read the policy, look at the numbers, understand what could change, and most importantly, ask how the decision could affect you, your family, and your community. Because once politics eventually leaves the television screen, it enters the household budget. It enters the doctor's office. It enters the pharmacy. It enters the workplace. And sometimes it enters the hospital room. What do you think?